Okay, now let's move on to differential oscillatory method. Okay, so in last class we discussed what is oscillatory method. Now that is the second version of oscillatory method is differential oscillatory method. Here we are going to use the two sensors. Okay, so that is the name here they have given differential. So we are going to have two sensor and difference of these two sensor values only we are going to process further in order to pick the what is the BP measurement, that is systolic and diastolic. This is also one of the non-invasive method for accurate BP measurement, but here they are using the special curve which is being mounted with two set of sensor. There is two pair of sensors, one pair of sensor, that is the two sensors. One is for cuff, and one is placed towards the cuff and another one is placed towards the blood vessels. Okay, so the A, for example, you have the sensor A and B. See, if you are see in this diagram, you can get to know you have two sensor A and B. The A which is placed towards your blood vessel and B which is placed towards the cuff. So the B sensor, what it will do in the sense, it going to sense the pressure changes in the cuff. Okay, what is the pressure changes? Where while you are giving the pressure, the cuff will get inflate, and also and when releasing the pressure, the cuff will start to deflate. So it can have some kind of changes in the air cuff for throughout the experiment, right? So that cuff air pressure changes will be sensed by the B, and A is similarly it going to see the pressure variation of blood vessels. During contraction you will have some changes in the pressure in the cuff. At the same time you will also have the similar changes in the blood vessels, because whenever the cuff is inflating, it will going to push your blood vessels towards inside. It means contracting your blood vessels. Automatically here also some pressure will get developed. Okay, so again when you are releasing the cuff, here also you have some changes. When you are releasing the cuff, same way here also in blood vessel also it can have the changes, that is the blood vessel will start to relaxing. So these two changes will goes in hand. Okay, so what difference you can see here in the sense, when the point, like when the point it contract, and soon after when it get relaxed, what happened, the blood will flow very hardly, right? So it follows turbulence, so that what happened, the vibration will create. That vibration is also being sensed by, that vibration will also be sensed by, or it will make some influence in the pressure. So that pressure variation will be sensed by sensor A. Not only the blood vessel changes, pressure changes, but also because of that vibration it will also influenced in the pressure changes. It cause some variation in the pressure, again that variation also being sensed by A. Now the thing is here, we have to segregate that vibration of pressure. Okay, the vibration of blood vessel, that is the pressure due to that vibration of blood pressure alone, we have to segregate it. So that is the reason here we have used differential oscillatory method. So see this diagram, you will get to know clearly. So the first the first graph, the second graph, the signal B is very simple, that is the cuff pressure. So when inflating or deflating, you can have some changes as a sine wave. If you see the signal A, that is a sensor which is placed towards your blood vessel. So the work of the sensor A is that it's going to capture the pressure variation again. So similarly, what you are getting in signal B, the same sine wave you will get in signal A, because both are vice versa. When when inflating the curve, here you have contraction, so both pressure is going to be same. When you are deflating the curve, again here you will be relaxing, again the both pressure will be the same. So there won't be any changes in the sine wave, but you can see the spikes over this sine wave. That spikes is because of what, in the sense the vibrations of blood vessels due to the turbulence flow of blood. That vibrations will speak a lot about what is the pressure during maximum contraction, what is the pressure at the relaxation. Okay, so in this signal A and signal B, there is a two sensor, it's going to get differentiated. That is, this sensor is called differential sensor. So when you are minusing these two, whatever the common waveform or frequency components are there, it will get cancel out each other. Only the uncommon things will get segregated down. The here if you see signal A and signal B, the uncommon things, what is that in the sense, it is nothing but your that spikes, which is representing what, your turbulence flow of your blood, that is a starting and ending point. So you will now this way you are getting the output of your differential sensor, that is only the spikes. That spikes, the starting spikes is nothing but systolic pressure, and the ending spike is nothing but diastolic pressure. So this way you are finding what is systolic and diastolic by using this special sensor mounted cuff. You can also call differential oscillometry method. Here also you are going to hear the sound, but you are here, there is no need of stethoscope here, but in place of sound you are focusing on what vibration of blood vessels. That vibration will causes variation in the pressure. So here your motto is just to only to focus on pressure variation. So sensor A will be focusing on blood vessel side, and sensor B is focusing on cuff side. So when you are differentiating both, you will get beautifully segmented of your vibration of blood vessels, the pressure variations due to the vibration of blood vessels. The starting point is systolic and ending point is diastolic. That's all. Thank you.